I would like to welcome on stage our next moderator, Lara Grosso Sategna. She's our network development officer at Healthcare Without Harm Europe, and she will lead us in the session Healthcare Professional Leading the Transition. Over to you, Lara.
Thank you, Gabriella. That was a great session, and actually it links very well to this session that I'm about to present. So this session is called Healthcare Professionals Leading the Transition. As Gabriella mentioned, I'm Lara Grosso Sategna, and I work as a Network Development Officer for Healthcare Professional Networks at Healthcare Without Harm Europe. I am very happy to be your moderator for this session. As we look toward a sustainable future, healthcare professionals are in a very unique position to lead the transition towards climate-smart healthcare. In this session, our speakers will explore how culture change, active engagement, and effective communication can make healthcare more resilient and sustainable in the face of climate change. We know that healthcare professionals are on the front lines of the climate crisis. Not only are they seeing firsthand the health impacts of climate change, but they also have the knowledge, skills, and trust of their communities to make a real difference. Their role goes beyond treatment and care. They are advocates, educators, and leaders. They have the power to raise awareness about the health consequences of climate change, of leading sustainable projects, or pushing for evidence-based policies, or empowering communities to both mitigate and adapt to the climate-related challenges that we are all facing. But before we start, I'd like to take a moment to inform you that unfortunately, one of our speakers, Anna Rakovac, has fallen ill and could not join us today. She was planning to share her insights on how healthcare professionals can actively engage in the transition toward climate resilience and mitigation, and also their crucial role as advocates for a healthier and more sustainable future. We, of course, wish her a speedy recovery, and while we will miss her contributions today, I am confident that the other speakers have plenty of valuable perspectives and knowledge to share on this very important topic. So I'm excited to dive into the discussion, but before we begin, just a quick reminder, you can submit your questions in the chat throughout the session, and we'll address them during the Q&A at the end. So please remember to write down also who your question is for. That will help me a lot. Thank you. Okay, so let's get started. Our first speaker is Kenneth Barker. Kenneth is a consultant anaesthetist at NHS Highland and also a member of the board at Healthcare Without Harm Europe. Over the past years, he has contributed to developing sustainability programs in Scotland and many other climate-smart healthcare projects. He will give us an example and an overview of some of these projects, as well as the actions he took to implement them in an effective and meaningful way. Welcome, Kenneth.
Thank you, Lara.
Your screen. Hello. The floor is yours. Thank you.
Thank you. So thank you very much to Lara and to Healthcare Without Harm for the invitation today to speak at the Climate Summit. It's traditional really to have a picture of your hospital when you're starting one of these medical talks, and this is my hometown of Inverness. I live just across the bridge there on the Black Isle, a nice rural setting. My hospital, Braegmore Hospital, is the large brown building on the right. I quite like to use this photograph for these kind of talks, though, because it's a metaphor. It's a good metaphor for what I think is climate action in healthcare until recently. This building is very poorly insulated. It has single glazed windows with metal frames. Until recently, it was heated with heavy fuel oil, and it has unknown and unacknowledged emissions into air, ground, and water. Now, other sectors in the area, such as farming, housing and transport, they did start to address their climate issues some time ago. But I think healthcare had been kind of blind to the 5% of national carbon footprint that we contribute. Until recently. So today I want to speak about how we clinicians can make significant difference to climate change within our health system. 80% of healthcare carbon footprint, of course, is due to the decisions that we make in our clinical care. And we can also mitigate against biodiversity loss by choosing the right tools and medicines and promoting circularity and good pharmaceutical husbandry. And you know, reflecting on what Judith Anderson was saying in the previous talk, a lot of us do have climate anxiety or grief. It has an emotional impact on us. And I think even by taking very small steps, we can begin, that action can begin to give us a purpose and ease that anxiety. So to do that, first of all, we must gather the evidence, and then we need to spread the action. And we do that, first of all, through local networks of clinicians. First of all, within your department, and then perhaps with specialty networks, and then moving on to national. Now, if you don't have a national group or a local group that you know of, particularly within your own specialty, then please feel free to start one yourself. It's not that hard, and grassroots is where the action is. We can make the difference, and then we can spread it far and wide. We can show what's done, and we can then go to approach government agencies who are actually looking for solutions to deliver the net zero target commitments that they've established. So we can show them the raft of actions that clinicians are already taking and the proposals for more. And of course, not forgetting to highlight the financial savings that often accompany the green actions we're talking about. So today I'm going to mention a few ideas we're working on in Scotland, both those being implemented currently and those being developed as part of our National Green Theatres programme. I know many of you will already be working on these kind of ideas already, but I think the important part is the spread and delivery of these actions across all of healthcare. Best done, I believe, initially through grassroots networks communicating with each other, and then also with government and regulatory support. I think the spread of these ideas, as I say, is the most important part. So, for instance, how did we make this change from a departmental desflurane action on the left in 2017 into a national action representing 8,000 tonnes of carbon dioxide equivalent savings by 2023? This particular success helped the action in spreading to other countries such as England and Wales. The following year, they also stopped using desflurane with 10 times the carbon savings and cost savings of around £8 million a year. Well, it was all about clinicians taking grassroots action. We formed a group of interested individuals in almost every hospital in Scotland. We called ourselves Green Anaesthesia Scotland. We communicated first of all through WhatsApp groups and then sharing scientific papers and consensus documents. And most of the work up until this point had been done through peer-to-peer education, as there were very few formal courses at that time. And we developed further actions on energy use, pharmaceuticals, circularity, and reducing microplastics pollution. And the work we were doing, of course, was being mirrored in other specialties and other areas as well. We learned how to spread that practice. We took a team stand at COP26 conference in Glasgow. And then we went to the European Society of Anaesthesia conference. This photograph shows the Dear Green space that we manned, educating our colleagues and supporting the Declaration of Glasgow on sustainability in healthcare. So this kind of anaesthetic gas work, which was our start point, became a catalyst for something much, much bigger. We eventually became a government-sponsored system change programme. So this is it. This is in August 2022, the Scottish Government published their Climate Emergency and Sustainability Strategy. And as part of that strategy, we formed the National Green Theatres programme. And there's a QR code there that will take you to our website if you want to look at more. We have a dedicated team of 8 employees at the Centre for Sustainable Delivery in Glasgow. And our job is to amass the evidence and identify more opportunities to reduce the healthcare burden on the planet. And of course, we started with surgical theatres because surgical theatres are the most energy consuming and waste producing areas of any other hospital. We developed about 50 discrete actions, and the majority of these actions, as mentioned, were cash saving, and we encourage the use of that green dividend for investing in new actions. But we do rely on the science being established, agreed, and then a consensus on what actions should be taken and when. So obviously there's a lot of ongoing research and quality improvement work currently. So our tagline really, the underlying principle of the programme is to embed sustainability into every clinical and managerial decision. I hope this tagline will become redundant eventually when that environmental sustainability becomes a core part of healthcare for everyone. How do we develop it? Well, first of all, we developed this aspiration document that we call the Ideal Green Theatre. This is where I like to imagine myself inside a shipping container, just an empty shipping container, and you ask the question, what's the minimum resource that I need to perform safe and effective surgery? Now, the answer actually can be quite surprising. A lot of what we currently provide in surgical theatres is just historical habit. Clinical practice changed and is changing all the time, and often design and building regulations do not keep up with that change. Now, we realised very quickly that in fact healthcare, particularly in modern high-income countries, is very wasteful of virgin resources. And so there's a real issue also with the size of healthcare. We're faced with silo working, with risk aversion, and even not knowing who's in charge. But we learned fairly quickly that it's really important to engage with leadership teams to help get all the colleagues moving in that same direction. So obviously, please feel free to look at the action list on the website, but I thought I'd talk you through a couple of examples. And the first one is one I pick particularly because finance is often held up as a barrier to change. But as I mentioned, in fact, it can also be an aid. Now, HVAC is heating, ventilation, and air conditioning. And in surgical theatres, it draws about 70% of the theatre's energy. Now, we know that the regulations for the building and maintaining these systems from as far back as 2016 actually stipulate that they should be automatically switched off overnight and at weekends. But for the most part, from our experience, that doesn't happen. They just remain switched on 24 hours a day, running all week, all year. So across NHS Scotland, if we automatically switched off these systems, we would save 5,000 to 6,000 tonnes of CO2 equivalents and about £3 to £4 million a year. Now, if you extrapolate that to UK terms, that's 30 to 40 million pounds of recurrent savings in the UK from just one green action. It would be lovely if we could keep some of that money for some of our further projects, but that's another story. We also need to seek out innovators in industry and work with new technology and new innovations, such as this one in sterilisation units. This is a firm called Tiny Air. They're testing a pre-cleaning system for surgical instruments that uses cold water and no detergent, and ideally it should be performed immediately after surgery, so on site in the sluice area. It replaces a very difficult manual job previously done by low-paid health workers who scraped off blood and tissue that was often dried on, sometimes 24, 48 hours later, and it was really an inefficient system. So the Tiny Air system, what that does is it increases the efficiency of the whole sterilisation process by about 10%. But key to this also, it decreases energy use by 80%, and it decreases water use as well. And we're also undertaking our own original research looking at redundant systems or possibly redundant systems that are provided in healthcare. And they're usually installed in hospitals because of rather outdated guidelines. This one, for occupational health reasons, systems called anaesthetic gas scavenging systems. They've been installed since about the 1980s in all hospitals. That was introduced, of course, at a time when anaesthesia was provided with high-flow, linear breathing systems and in operating rooms that had poor ventilation. Nowadays, of course, we use circular breathing systems that have very low flows, probably a 10th to a 20th of what we used to use. In theatres that have exceedingly good ventilation with air changes of 39 to 110 changes per hour. So we're using a computational dynamic flow model to study the anaesthetic gas exposure over time at each of these occupants' breathing areas. And the initial data supports our impression that these scavenging systems may not be needed in modern practice. And they, in fact, could be switched off, saving energy and maintenance costs. Another significant problem of modern healthcare, our effect on groundwater and biodiversity, is where we're looking really to our clinical science colleagues for leadership. Microplastics are a product of the single-use mantra across all of society, but particularly in healthcare. And it's leading to effect on human health that we probably never dreamed of a few years ago. People with evidence of microplastics deposition in carotid plaques, even after having an operation for carotid endarterectomy, are still 5 times more likely to die of a stroke or a heart attack than those who do not have plastic. There also is an effect on human fertility. And so while current scientific investigations are working out the potential solutions to this, what we can do as clinicians is try to minimize the input of microplastics into the biosphere. So as part of a national campaign, many of you will have the same in your own countries, we're encouraging, first of all, the appropriate use of non-sterile gloves, so only for blood, bodily fluid or chemical exposure. We know that in Scotland we use enough non-sterile gloves that if we laid them end to end, they would and tie a bow at the front. And the aim, if we can mimic pilot work done in Great Ormond Street in London, is to reduce that by 18 to 20%. We also need to be prepared to question and fully justify the use of any single-use plastics device. And we need to address the throwing away of surgical instruments like laparoscopic ports. These are examples where these tools, there are examples where these tools can be cleaned and reused up to 18 times, such as robotic surgery. And many other instruments, it's possible to remanufacture them. So that's, you take them away, take them apart, clean them, repair them, sharpen them, etc., and reuse. But we haven't got that embedded across all surgical specialties, and we need to do that. And of course, we can address the 88,000 tonnes of surgical gowns and drapes currently being used in the UK by returning to a reusable textile model. Now here's another example of healthcare being prepared to invest in new technology. This local firm, Pure Water International, has a £1.8 million contract at my hospital to install a water filtration system that removes microplastics and pharmaceuticals from laundry wastewater. You'll see the bottles there, the one on the left pre-treatment, the one on the right after, and the pink kind of tinted solution in the orange bucket, that's the microplastics being taken out. Clinicians, as you know, we're all used to dealing with a risk versus benefit equation in everyday clinical situations. It's the basis of the patient-centered consent process. But of course, health systems are generally quite risk averse. So by including clinicians in the development of these sort of technologies and actions, even when we're quite distant from that coalface of patient care, we can still help to reflect the importance of the whole system change that's needed to benefit all our patients. So this first year with the Green Programme, Theatres Programme in Scotland, we have a population of about 5 million people, and we've identified about 20,000 tonnes of potential carbon dioxide savings. That will need to be validated by the individual health boards and hospitals and then measured once delivered. But I think the key action associated with that is that the health boards are now legally obliged to deliver on their annual plan that they've implemented these actions over the course of the year. We also have evidence of around £6 million of cash dividend from these actions in hospitals. And of course, we are just getting started. There's a few more actions, and we're spreading to other areas of the hospital, such as renal care, endoscopy, labs, and some clinical pathways work. But ultimately, across the hospital and into community care as well. And perhaps more importantly, we're disseminating the knowledge about sustainable care to our medical students, our nurses, and our pharmacists all across. In effect, we're kind of embedding green practices into the future. So ultimately, what we have to do is examine the changing nature of our clinical responsibility. Our patient is not just that person in front of us, but it's their family, their community, our society and humanity. So good environmental stewardship is good patient care. Thank you very much.
Thank you, Kenneth. That was great. It's very nice to see like how the clinician's eye can help rethinking the care pathway and the healthcare system in general, but also how you involved other professionals in your projects as well. That's very important. I have a few questions for you that will hopefully expand on what you just presented and showcase even more the important work you are doing. In your presentation, you briefly mentioned about a group of climate-conscious anesthetists. Could you share, well, you shared already a bit of the main reasons behind its establishment, but were there any key takeaways or collective insights that emerged from it over the years?
Sure. I think anaesthetists have been somewhat at the forefront of the climate action in healthcare, certainly in the UK. And very grateful thanks to a man called Tom Pierce, who is an anaesthetist from Southampton. He was doing some talks around the country, and he spoke at a meeting in Scotland. And that was the spark which actually got things going. It was very obvious that we as clinicians could do work on nitrous oxide and some of our volatile agents. And I guess one of the key things to take away from that was that there was such a great amount of enthusiasm for doing something. When presented with the evidence, but with also the knowledge that the change was relatively easy to make, and there was no evidence of harm or issues, any issues with patient safety or clinical effectiveness, then it became a what we call, I suppose, a no-brainer to make that change to a simpler form without nitrous oxide and without desflurane, one of our less climate-friendly agents. The enthusiasm actually then, as I say, spread amongst us. We managed to get most of Scotland covered fairly quickly, and we started to talk about these other kind of actions that we could take. Because I think if you stand in theatres, if you're doing an operation, you stand and you look at, number one, the waste, and the sort of energy intensive practices that go on in theatre. In a way, we were almost surprised how invested all our colleagues were, all our theatre staff and our surgical teams. But we shouldn't be surprised, really, because we do all this stuff at home, don't we? We switch off lights, we don't leave the TV running. We're all aware that, in fact, the vast part of our personal climate footprint is actually our work-related carbon footprint rather than at home. It seemed nonsensical not to do something about it.
Yeah, that's very important to kind of start from your own personal and individual change and kind of bring it wherever you go and wherever you are, also in your profession. That's very important. And when implementing these projects that you just presented, what were the main challenges or obstacles that you and your colleagues faced? And do you have any strategies or actions you took to address and overcome these challenges?
We are clinicians. We're not climate scientists. We, as I said, we didn't have any formal education in it. We self-educated for a lot of it. But one of the great helps in our system here is that we did have environmental officers in most hospitals. So these tended to be people who were part of the estates team and often had other responsibilities as well, such as energy use or waste, water, etc. So they had a more overarching idea of what was going on and what government targets they were expected to meet in the non-clinical sphere. But in speaking to them, they had actually had some years of trying to engage with clinicians with little effect. And so by engaging with them, we were able to utilize their expertise, have their input into the management structure of the hospitals, and help us to progress some of our clinical-based projects. But at the same time, we recognise that an awful lot of our clinical-based projects had to involve them anyway. So, for instance, turning off nitrous oxide manifolds, which is a really key action because of the amount of waste associated with those systems. That involves theatre teams such as anaesthetists, pharmacists who do the ordering, but also the estates team who manage and maintain these areas. actions, and the argument about identifying your financial savings and trying to, you may not get the actual money in your hands, but as long as you can put a marker there to say that this action saved this amount of money, you can sometimes peg that against any further investment that you might need the managers to approve. So overall, it was a recognition that we needed help, and moving on to the sort of bigger program, we also recognised that we needed national bodies to assist with us. We had infection control colleagues that needed to be consulted on a large number of the actions. As again, patient safety has to be paramount whenever you're talking about changes within healthcare. And as I mentioned, there is a high degree of risk aversion within healthcare, so you have to make sure you've got the evidence to support any action that you're putting forward. So I'd say that was the main lesson. We had to make a lot of friends.
Yeah, absolutely. It's a complex ecosystem, so it makes sense to involve people on an ad hoc basis and moving forward depending on what their specialty is, and to make sure that the project is kind of contributing in a meaningful way and making sure that patient safety is at the center for sure.
Yeah.
I have a last final question for you, because you touched upon the fact that when you started, you and your colleagues were mainly learning from peer-to-peer education approach, like you took this kind of approach, and considering that only a small part of medical curricula addresses planetary health and climate change at the moment, what steps can healthcare professionals take to bridge this gap? Of course, it's not solely their responsibility, but is there anything they can do to kind of make sure these issues are prioritized both in education and at policy level?
Yeah, yes, indeed. I mean, I mentioned the enthusiasm we found amongst theatre teams and our own staff colleagues, but that's also mirrored in the enthusiasm from students across all specialties, medical students, nursing students, pharmaceuticals, etc. You are correct. There's a limited amount, I would say, within medical school curricula that specifically brings climate into the curriculum. What we found initially was that we had enthusiastic students coming along asking to do special study modules, which involved a project. Those projects have been really excellent standard, and we have utilised some of those projects, in fact, to evidence some of the actions we've put forward in the National Green Theatres programme. And it's a good experience for those students because they do the project, they publish it, but they also present it to, becomes part of a national program, which is good news for them. So they'll like that part of it. But yeah, the bigger picture, you can't just rely on a few enthusiastic students. We've got to have it embedded into the curriculum. And more recently, students themselves have been agitating for that by completing things like the Planetary Health Report card that universities sign up to. And we've been meeting as a program with the consortium of medical schools in Scotland. This of change onus on educators to have at least one slide in each of their talks issue on the subject that they are. Is that there will be acknowledgement across the medical curricula, and that students will not have to be re-educated when they start work in the systems we have, and that any new ideas we have are already embedded in the future.
That's great, yes. And also in line with the theme of this year's summit, it's important to think not only about healthcare professionals now, but also healthcare professionals of the future. Yeah. So that's a very important point. Thank you so much, Kenneth, for discussing with me. Let's move on to our next speakers. We all know that being able to communicate about climate and health and their interdependence is key when leading the transition. That is why our second speaker today is Hope Robinson, Climate Communications Officer at Healthcare Without Harm Europe. Hope will discuss how healthcare professionals can be powerful climate communicators and will give us an overview of the resources we have to support them in becoming skilled advocates for climate action. Hope we can see your slides. The floor is yours. Thank you.
Thank you so much, Laura. Thank you. It's a pleasure to be here. Good afternoon, everyone. As Laura kindly introduced me, my name is Hope. I'm a Canadian infiltrating your ranks here in Europe. I'm very, very happy to be here with you today to speak about how healthcare professionals can become powerful climate and health communicators, able to engage within your organization, with the public, and also with policymakers on the urgent need for climate action, particularly through the lens of health. I want to start by stating the obvious, or what may seem obvious, but I don't get tired of saying it, which is that effective communication is at the heart of all progress. Every single initiative, collaboration, policy change, or community effort begins with discussion and shared understanding and community, which makes the role of skilled communicators more essential than ever in driving meaningful progress. And I also want to acknowledge that every single presenter we've had today has been an incredibly effective communicator, and it's a joy for us all to see. So thank you for being here with me to talk about this topic today. So I'm going to cover 4 topics, starting with why healthcare professionals are uniquely positioned to communicate impactfully about climate change, referencing some academic stats for those of you with the science mindset, aka probably all of you. Then I'll outline the core principles for discussing climate change and health to advocate for climate action from a communications theory perspective. Third, we'll explore how to get started on this journey with Healthcare Without Harm Europe's communication guides designed for healthcare professionals, presented in a suggested order from the most beginner-friendly resources to more advanced ones that will help you further expand your skill set. Finally, we'll take a brief look at an example from one of the guides that focuses on responding to common misconceptions about climate change in Europe, so everyone that's here today can leave with a response in mind should they ever encounter this myth in their lives. Let's get to it. First, I feel it's important to set the scene by considering why healthcare professionals are uniquely positioned to be so effective at advocating in this setting, both with and beyond the healthcare sector, which has 2 core elements. First, as I'm quoting from Howard et al. 2023, as trusted voices within communities around the world, health professionals have enormous potential to influence the social and policy landscape in support of decarbonization and climate resilience. Health professionals are highly trusted due to your ethical standards, your scientific literacy, your expertise, and your involvement in the community. And thus, your behavior and messaging can be influential on those around them and those above them in the policy sense, and those that they aim to influence. This trusted position can be especially effective when used to frame climate change and the climate crisis in terms of its health impacts. Research has shown, recent research in fact, that health framing of the climate emergency has proven effective in inspiring populations to take action. So health professionals can catalyze climate action using their credibility in the health field and firsthand experience in more than often to highlight the direct impact of climate change on public health, and by linking climate action to the promotion of health for everybody. This combination of health professionals' trusted status and the effectiveness of health framing, which they can speak to more than really anyone in society, offers a very powerful opportunity to communicate in a way that has a wide impact, creating dialogue, open minds, and catalyzing actions. So next, let's talk about the 5 core principles to keep in mind when communicating about climate and health to advocate for climate action. First is a rather technical one, but I'm pretty sure you're all familiar with. It's just the importance of considering climate action as mitigation and resilience and communicating it as such to others. Mitigation, of course, focusing on reducing our carbon footprint, lowering emissions, and an adaptation focus on adjusting our systems and processes to cope with ongoing and future effects of climate change. By advocating for both, we're taking a holistic approach that creates a system that doesn't only minimize harm in the future, but also protects communities actively now, which often garners more support. The second principle is to focus on local and immediate impacts to make climate change a tangible issue. You can do this by making climate change personal and local through scientific realities that you can communicate from your experience. For instance, we know that climate change contributes to an increase in extreme weather events, air pollution, and the spread of vector-borne disease. But pointing to specific instances of climate change affecting your local communities is key, whether it's increased wildfires or flooding or disease vectors. People are more likely to believe something if they see its effects in their own region. Share stories about how healthcare systems have been stressed by climate-related events, emergency rooms filling up in certain cases, and this can help people understand climate change as a hard reality that they face regularly now, rather than a distant, wicked problem. Directly related to the above principle is the third, emphasizing the co-benefits of climate action. This looks like explaining that actions to mitigate climate change are not just to reduce emissions, which may seem like a concept many people don't really care about, but directly improving public health. For instance, better air quality leads to fewer respiratory diseases. The same goes for adaptation. Fact is, everyone is much better served when their community has reinforced their infrastructure and strengthened their processes so that our systems don't fail the next time we face a major climate event. Many of these actions can also reduce costs long term. This emphasis makes these solutions feel more immediate and beneficial to their health and well-being. The fourth is to practice empathy and accessibility. Empathy looks like not trying to win a conversation, but acknowledging people's fears or skepticism, which can help to bridge that gap. Further, though you don't need to be a climate expert to advocate for climate action, healthcare expertise itself lends credibility when using health framing. So make sure to speak in accessible language and avoid technical, medical, or climate-related jargon. That's part of creating a compassionate exchange with someone. The last is to offer hope and highlight success stories. And that means we don't need to highlight just the negative impacts of climate change. Although acknowledging urgency can be very useful, and as Judith wisely said earlier, we need muscly, strong hope that makes space for grief and fear when it comes up and does not deny that fear. But only negativity can paralyze people with fear and prevent action. So we encourage you to still encourage hope through concrete solutions and through reminding others of the amount of people in the world committed to making change. You can use storytelling to share real examples of individuals and communities and healthcare systems that have successfully addressed and adapted to climate change. Emphasize success stories like many of the ones you might have heard today, and reframe climate action as an opportunity to enhance both human and planetary health across multiple dimensions. As a common English expression goes, to lift all boats. This practice helps people to associate climate action with improvements in their life and be motivated to join the movement for something they might not have understood before. Now let's get to what resources we have at Healthcare Without Harm Europe to support healthcare professionals to gain and hone these communication skills. These two are our sort of intro level guides if you haven't quite thought about how you communicate before. In Using Your Voice to Drive Climate Action, we offer a broad getting started guide to finding and using your voice as a healthcare professional, from figuring out your communication style, identifying who your ideal intended audience may be, to using social media, and to preparing clear and to the point messaging. In the second guide on your right is debunking climate myths and empowering climate action. We have done some message crafting for you in this guide, where we've distilled some complex ideas about climate change into clear and relatable messages that will help you to confront and challenge misconceptions or myths, as we call them, and expose how they're false in an empowering way. Our next two guides, which I call Taking the Next Steps, offer slightly more advanced and in-depth strategies to help you further develop your advocacy and communication skills. In Teaming Up for Sustainability, we offer practical steps you can take to collaborate horizontally across your organization to create change, particularly as healthcare can remain a very siloed sector. A great guide for when you're ready to advocate more directly and when you remember that there is strength in numbers. In Mastering Media Interviews, we pull the curtain back on how media and journalism operate and how you can navigate that, preparing to give great informative interviews calling for climate action. To note, all of these guides are available in our virtual booth here on Hubelo for quick access, or our website, except for Teaming Up for Sustainability, which is available to members of our Global Green and Healthy Hospitals Network or our healthcare professional networks, which are all free to join and absolutely worth it. This brings me near the end and the fun little bonus section of sharing an excerpt from our most recently published guide, which was the Debunking Climate Myths and Empowering Climate Action. I chose to put one that I think comes up more often than you think, which is the idea that climate change doesn't affect us in Europe. For instance, I'm from the province of British Columbia that Judith referenced earlier in her presentation. And while it's true that the heat waves that affect my home province are devastating year after year and make the news globally, we also face problems like that here in Europe, and it's key to associate that with the local population. Us heating up faster than any other continent in the world. We also have contributed, Europe has contributed significantly to climate change and still does, producing over 17% of cumulative CO2 emissions globally since the start of the Industrial Revolution, which was over 200 years ago. So we're part of the problem and must be part of the solution. To finish, I'd like to share a little quote that I hope reflects the key takeaway of this presentation, reminding all healthcare professionals of the critical role you can each play, whether doctor, nurse, administrator, or support staff, in shifting practice, finance, and power, the big three, by using your voices and taking action. I encourage you all to also read this article I've cited below on how the health community can maximize its influence on driving the transition to net zero and climate resilient societies. It has a really useful strategic framework. I also encourage you to check out our comms guides to get some practical tips to start communicating in your circles right away, and check out my slides after the fact in our virtual booth for all the references if you want to read some more. Finally, thank you for being here with me today and with all of us at the summit, and for each effort that you make, like showing up to learn. So I hope you enjoy the rest of the summit.
Thank you, Hope, for sharing those valuable strategies for clear and impactful communication and how to use our communication guides that are there, and they're very important to use. Now, I'd like to invite on screen the two speakers, Hope and Kenneth, for a very short round of Q&A. I would just like to mention two things before we start. One thing is that apparently the QR code that was shown in Kenneth's presentation is not working, but I would recommend Kenneth to go back to the chat and just provide the link. And second thing is that there's a technical glitch. So Kenneth is replying already to questions, I see, but he's replying as Ginevra. So I can ensure that's Kenneth. We just had a technical glitch, and it's not an identity being stolen. All right, I think we can start with a few questions. I have one question for you, Kenneth, and it's from Astrid von Schemling. Is current EU and UK medical and healthcare legislation a barrier for shifting away from single-use plastics in hospitals? I guess because you touched upon this during your presentation. Or is it a trigger for greater focus on smarter solutions like elimination of PFAS? A tricky one.
Yeah, so medical device regulations are something we've actually come up against recently. What we've discovered, as I said, we're being educated as we go along, and what we discovered recently was we'd been engaging with a manufacturer to ask if we could move from a single-use plastics device back to we wanted a totally reusable, but we came to a compromise where they were able to remanufacture and use the single device up to 20 times. But in our current regulatory framework, it's a medical device class 1. Now, class 1 is the external part of the body, generally speaking, the lowest impact. We discovered that class 2 and class 3 you can remanufacture, but class 1 you can't, because simply because there isn't a framework to have the process inspected and verified. So we're faced with challenges that perhaps we haven't come across before in dealing with a single-use mantra that's kind of been creeping up on us for the last 20, 30 years. I think the thing to do is to work with industry to tell them what we want. We use our massive procurement budget in the billions of pounds in every country in Europe to influence the market the way that we feel it should go. And I think the procurement organisations are beginning to get that message. Most of them are now incorporating a kind of environmental weighting within their contracting decisions, and I think that is the way to do it, to move the market the way that we feel it should be, that would be best for our patients. Does that answer the question, really?
I think it does, but the person will let us know in the chat. And as more questions are coming in, I would just recommend both you and Hope to write down your answers. And I've seen that some of the questions were already kind of addressed in the chat. And I have a question for you, Hope. From your perspective, what role can healthcare professionals play in advocating for policy changes that address both climate and health? So what kind of support do you think is needed at institutional or organizational level?
Thanks, Laura. I think it's a great question. I think the key thing to remember is that healthcare professionals have the evidence and expertise to link climate change to health, which is just the fundamental truth of the situation that we're in with the climate crisis. And remembering that and pushing that as your main point can really get you far, given the credibility behind your position that you've obviously worked hard and been educated to have. Engaging in public campaigns, writing op-eds and pitching to your local news, testifying before bodies when you get the chance, working with professional associations to lobby, attending events like these and networking to form wider groups that can advocate together is really important. I also think healthcare professionals are really qualified to advocate for equitable solutions because they're often aware about marginalization in their communities more than your average person, and they can really advocate to the fact that those communities tend to suffer the most or bear the heaviest burden of the climate crisis, which is a reality. In that light, I think support for education and training is a huge institutional support that can make more healthcare workers sort of empowered to be advocates in this way. So I've learned a lot just today, even from Kenneth's presentation, about creating a culture of advocacy, really, and of taking action. Incorporating climate and health training where possible into practices is an absolute must, I think, for the healthcare sector in Europe, and is becoming more and more normal also, which is really awesome to see. Additional thing is to offer platforms for healthcare workers to engage in advocacy, which we saw earlier, having partnerships with organizations like Healthcare Without Harm Europe, because we're very focused on capacity building, is a similar way that we can build that sort of strength and culture of advocacy among healthcare professionals. And the other is just to sort of, for lack of a better expression, fake it till you make it, and remember that you're more uniquely qualified than you think, and not let imposter syndrome get you down. I know that a doctor or a nurse, or the ones I've been lucky enough to experience in my life, certainly they're not telling me any nonsense. They're very straight to the point. They get right down to business. They don't have time to waste. This is the same situation. Apply that same logic when you're talking about the climate crisis, because frankly, we don't have time to waste. But there's also still hope, just like when you have a medical issue. So remembering that, I think, can take you really far from someone who's not a healthcare professional, but recognizes the power that's there. So I hope that's a good answer.
Yeah, absolutely. Thank you so much. I feel like we already have a lot of key takeaways. And again, if you have other questions, don't hesitate to put them in the chat, and the speakers can go back and reply to them in writing. But also you can reach out directly to them via the People tab on the main homepage. So that brings us to the end of this session. Thank you to our wonderful speakers for their insightful presentations. It's clear that healthcare professionals have a pivotal role to play in leading the transition towards a more climate resilient and sustainable healthcare system. I would also like to thank you, our audience, for your participation and thoughtful questions. I saw some comments in the chat, and it was great to seeing you interacting. Remember that this important transition begins with each and every one of us. Every action you take, no matter how small, contributes to a larger effort, and your engagement is the key to ensuring that this transition is successful. So on this positive note, I'll now hand moderation back over to Mireia for our closing session of the day. Thank you.
Thank you, Lara. Thank you so much. And hello, everyone, again. And for